Welcome back to This Week in Global Health, otherwise known as TWIG. TWIG is a weekly live global health news roundup. This week, we've got a very special episode for you. We've got the Pulitzer Center, with a representative from the Pulitzer Center with us as a guest, and we've also got a freelance journalist. So we're talking about global health journalism. I just want to say welcome back to the rest of the panel. Chris has been in the Ukraine. Susan is currently in Nigeria. Katie's back from Geneva, and I'm back from South Africa, so we're all back. We've got two guests. I want them to introduce themselves quickly. We'll start off with Emily. Emily, quickly tell us about who you are, what are you doing here, and tell us something about yourself that nobody else in the world knows. No pressure.
Sure. Thanks, Greg. My name is Emily Baumgaertner. I am actually the Health Projects Coordinator here at the Pulitzer Center on Crisis Reporting in Washington, D.C. Something that nobody else knows about me, I hate pumpkin-flavored foods.
Come on. You had the Starbucks pumpkin-flavored latte. Great. I love it. Okay, Joanne, talk to us. Who are you? What do you do? And something, I was going to say something embarrassing about yourself, but perhaps a secret that nobody else knows.
Oh, boy. Well, I'm Joanne Silberner. I teach journalism half-time at the University of Washington, and the other half of the time I'm a freelance reporter, and I focus on global health issues. Boy, I'd love to steal Emily's pumpkin feelings because I feel the same way. And other than that, I have to say my life is an open book.
Excellent. I like it. Right, we're going to jump right into the show. We don't have the usual Global Health Now news roundup because Brian unfortunately couldn't be with us tonight, but we're going to jump into the show. I'm going to ask Emily a question. Emily, could you tell us a little bit about the Pulitzer Center? Who are you? What do you do? What's the lowdown? What's the word on the street?
Sure. So the Pulitzer Center is a nonprofit journalism organization. We're dedicated to supporting independent international journalism. So what that means is that we focus on underreported topics, namely the root causes of some of the issues in the world today, and several of them are global health issues that we're focused on. So we do that rather than covering front page breaking news that you see in other outlets. Our model is one in which we don't compete with media outlets. We actually work with media outlets. So our role is to provide travel grants to anyone who is looking to travel abroad and cover some international underreported topics, and then we help place that content in major media outlets so that they can reach a broader audience. And we also do an increasingly large amount of education work with students ranging from elementary school up through colleges and universities.
Emily, could you perhaps just give us an example of the kind of media outlet that you refer to? Would that be sort of the newspaper and television and news shows?
Sure. I'd say a wide range of them. We've had placements in several different outlets. Some of them are a bit more technical and specialized, and some of them are more general for a much more public audience, such as the New York Times, Washington Post, newspapers like that.
Thanks. Brilliant. Very interesting.
Sure.
Okay. And then, Katie,
so next up,
you're up.
We wanted to hear just a little bit from Joanne, if possible.
Well, I can tell you my experience with the Pulitzer Center. The Pulitzer Center has sent me to Haiti, India, Uganda, Australia, Fiji, and Cambodia to do stories about neglected diseases.
And Joanne, could you tell us a little bit about what drew you to journalism, and in particular, what drew you to journalism in the global health space?
Well, what drew me to journalism was just inherently curious. I want to understand how the world works. I want to talk to people, ask them questions. You know, how does this happen? And if you don't have a microphone in your hand or a notebook, you know, you can be pretty intrusive. But as a journalist, I can go and ask people questions about anything, and I love that. I'm also very obstinate, so that drew me into the obstinacy, and the curiosity drew me to journalism. And I was doing health policy and American health issues for a long time, and it was getting a little frustrating, because things seemed to spin a lot, and I thought, maybe I should move out, and I started looking into global health, and it was very interesting. And then when I got into it, I realized it's very frustrating. Things seem to spin a bit, but even so, the issues seem so important, and it's so important that people know about what's going on that I've stayed here very happily.
Yeah. Now, in terms of the intersection between global health and journalism, your background is in biology. Please correct me if I'm wrong. So you started out in that scientific area, and then you sort of ended up segueing into journalism. In your opinion, we both know that both of those areas of work, global health and journalism, are very important. Why are they important to each other? Why does the global health community need journalism and need these voices sharing these stories?
Well, I think the answer is in a survey that was done. It's done every year by the Kaiser Family Foundation. And they go out and they ask the American public, how much of your tax dollar goes to defense? How much of your tax dollar goes to all these issues, including international aid, global health efforts, and other efforts on the international level? How much of your tax dollar goes there? Most people say 25% or more. They think that that much of their tax dollar is going to help people in other countries. It's less than 1%. So these are the people paying taxes and electing politicians, and they have no clue that so little of our money is going to help people in other countries. And what's brilliant is that the Kaiser Family Foundation, in their survey, now goes back and says to people, if you knew that it was less than 1%, would you want more to be spent? Nearly 60% of the public says, yes, I would want more to be spent. So people don't know where their money is going. They think that they're doing good. They think that their tax dollars doing a certain kind of good. And it's important to let them know what is happening, what is going on, what good is going on, and what bad is going on, too.
Mm-hmm.
That's
Very relevant.
That's really great, Joanne, and it kind of shows how Pulitzer Center is really involved in kind of relaying information. My question is actually for Emily, though. Like, apart from giving out information to people who may not have access to specific global health sources, can you also tell us what are the other ways that Pulitzer Center on Crisis Reporting is strengthening the state of global health information?
Sure, certainly, I'd love to. So the Pulitzer Center, is kind of behind this idea that we do need translators to interpret science for the lay ear. The Pulitzer Center believes, especially on our global health reporting, that no matter how much excellent progress we're making in the global health field, the average American is not reading The Lancet on their way to work in the morning. So we need to face the fact that we need reporters who know their subject area and who really dig into the subject area and take a nuanced approach. And so that information surrounding disease can generate awareness rather than just simply generating fear. So I'd say that some of the ways that we're doing that here, some of the forms that takes on in the Pulitzer Center model, is through the three different approaches that I mentioned earlier. First, our reporting grants, which cover those travel costs for underreported issues. But secondly, our campus consortium program. That's a program that we have for colleges and universities. We've got almost 24 at this point, with colleges and universities bringing journalists to campus around the country to engage students, and also to send some student fellows abroad. They've got student fellows that will travel and do their own reporting projects. And then lastly, the Pulitzer Center has an education program. Huge chunk of our programming is education work, and that's in primary and secondary schools. And it really allows young students to interact with journalists, to be exposed to some of the unique global health issues that are out there, and to offer an opportunity to learn and to do some journalism of their own. And so I think we're trying to strengthen the state of the global health information at all of those levels, not just in the newspaper, not just in the classroom, but across the board.
So you mentioned campus consortium, Emily. So these are basically fellowships which are open to students across the world, or is it?
Yeah, we've got 23 of them in the United States and one abroad, and working to do some more as well.
Fantastic.
Well, and I have just a quick point. Sorry, Katie. It seems like you're involved in many consortiums, because we also became really familiar with the Pulitzer Center at CUGH this year at the Consortium of Universities for Global Health, where you had an event that actually Brian Simpson from Johns Hopkins and Global Health Now was on. So you guys are sort of getting involved in everything. That was a really interesting panel that you hosted on science communication. So it's not just that you guys are delivering information to people and supporting those who do, but even teaching people how necessary it is to be able to communicate across different disciplines. And that's something really fantastic about what the Pulitzer Center is doing. Is that something you're planning on doing next year potentially, or?
Yep, we'll certainly be at CUGH next year as well. I think any opportunity that we have to really, any opportunity that we have to connect with those who are experts in their field and help them find ways to spread that information to a larger audience than what they're used to is just a win-win all around.
And that's really interesting.
I believe that that's where Chris and Katie. No, Chris and Emily met. Was that the beginning of all of this?
That's
correct. I understand that there was a bit of wine involved as well.
Greg, isn't there all?
There's no secrets here. We're an open book. Trying to be like Joanne. Open book.
Yeah.
Okay, sorry, Katie, jump right in.
I just wanted to follow in, if people will let me speak. That was really important what you said, I think, Emily, about the science and stuff. So I'm going to actually direct this question to Joanne. What about people in the global health field that have no journalism or communications background? How would someone like that get started if they want to meld the two sectors together?
Well, they shouldn't expect to make a lot of money or to be particularly successful, but they should try. It's so important. When I'm always saying the first word in public health is public. So, for example, there was a student who graduated from the University of Washington with a master's in public health. She's a nurse, and she's been doing a lot of work with Doctors Without Borders and other groups. And she went over to West Africa several times to work on Ebola. And she was seeing things, and she had things that she thought was important for people to know. And she started writing about it. She's a great writer, and she submitted one of her pieces to the New York Times. It was about the difficulties of transportation and how that affected the Ebola efforts. And that's important because, when people donate money, they want it to go right to patient care, but, sometimes infrastructure is important. Sometimes, primary health care is important. So she's been writing about this. Her stories have appeared in the New York Times, in the Seattle Times. NPR has had her in her blogs. She's having her voice heard. She's helping individual patients, yes, as a nurse, but she's having an even bigger effect by telling people this is what's going on and the world needs to be involved. And she's able to do that by writing for the general public. It's a challenge, and not everybody gets into the New York Times, especially not on the first try. She started out at a blog that's here in Seattle called the Seattle Globalist, and they ran some of her things. Then she built up, then she went to the Seattle Times, the New York Times. You can also do it through professional outlets. For example, the New England Journal of Medicine has a section called Perspectives. And when I was in Haiti with a surgeon, a gynecologic surgeon who was actually delivering babies in Haiti after the earthquake, and she really had a lot to say, and she really thought other doctors who were thinking about volunteering should know what the experience is like. So she wrote something for the New England Journal of Medicine, and her peers were able to see that, and they could see how they could get involved as well. So you really multiply your effect by going to the public or going to a particular group and saying, look, this is what's going on.
Mm-hmm. Mm-hmm. And it helps sort of get that support from all of the external factors. And just to highlight the fact that you said somebody who goes into global health journalism should expect not to make very much money. That is the condition of global health in general. I haven't met a single person who got in it for the paycheck. So
That's really true. And here I'd like to mention Joanne. So I have a lot of classmates at Duke Global Health Institute who are out doing their fieldwork and across the world, literally different countries. So what would be your advice? Because the tough bit is getting started for students who are global health students, public health students. How can they start? Your 2 cents.
Well, think about where they want their message to be heard or their story to be told, and go to that outlet. If you want to tell a professional journal, look at your professional journals, the ones that you look at what you're reading, and say, how can I get in there? You can go to their website, you can call people there and say, I want to write an editorial for you, I want to write a perspective piece for you, how can I do it? And start. The hardest thing is to start, to sit down and write something. Look to journalists for help and advice if you know any journalists. Look to people at the journals or the newspapers that you're writing to. Again, places like the New York Times are interested in hearing first-person accounts. And if you can get to the right place and submit it, there's a chance that it might run.
And a quick advert while we're talking about where young people that want to write can publish. 2 things. Firstly, our webpage, so twig, twigh.org, has a blog, and we accept submissions from anybody, right? So if you've written something, you've got something to say, something interesting, you want to write up a blog, you can submit your blog at our webpage, and we'll put a link to that in the show notes, And it gets seen. We've got an editorial team. They look at it, so we don't just stick anything on there. But we also don't have that sort of high barrier to entry that you may have with a peer-reviewed journal, for example. So we'll read it. If we think it's any good, we're going to stick it on our webpage, and it'll get some visibility. So that's one thing that you can do. Second thing, if you've got a story to tell, you can reach out to us. And this is another outlet. You could come onto our show as a guest panelist and tell your story. So think outside the box. You know, there's not just print media. You can come onto YouTube and tell your story. And then the third thing, while I'm doing quick adverts, is I'm also the editor-in-chief of a journal called Globalization and Health. So if you've written up a good piece of research and you want that published in a peer-reviewed journal, then go to globalizationandhealth.com. Good journal. I like it. Okay, carry on with the show.
Good plugs, Greg. Now, how can audience members watching this get involved? I'm going to direct this one toward Emily. How can audience members get involved with the Pulitzer Center? What are avenues that they can contact you at? What are some good first steps?
I would definitely say contact us. You know, whether you're a student, a teacher, a researcher, a reporter, we have opportunities to work together. And so if you just want to shoot me an email, I think my email is right there in the show notes. You can shoot me an email and I'll get you connected to wherever you need to be connected to.
Okay. And then it is, I'm trying to remember your email off the top of my head. Is it E. Baumgaertner or Emily Baumgaertner?
Yep, E. Baumgaertner. My first initial and then my last name right there at pulitzercenter.org.
Fantastic, thank you. Let's see. All right, and then
Joanne, could you just tell us a little bit about how you became involved with the Pulitzer Center? So how did that connection take place? Did you reach out to them? Did they reach out to you? Did you meet at a conference and have a glass of wine? What's the backstory between your relationship with the Pulitzer Center?
Well, it involves theft. It involves, there's a reporter, environmental reporter who I admire very much, and I was looking at his website one day and I was wondering who supports him, where is he getting the money to do all this? So I went to the list of supporters who he had, and I saw that the Pulitzer Center had funded some of his work, and I thought, well, okay, maybe that's a good group. They're funding him, and I contacted the Pulitzer Center, and it turns out that they had good contacts with an editor who I work with at the radio program The World, at PRI's The World. So it all sort of fell together at that point, and their interest in neglected issues really parallels my interest in neglected issues. And the first big thing I did for them was a series on cancer in developing countries, which has really been a neglected issue.
Okay, and a quick question to Emily. Emily, the Pulitzer Center covers underreported stories. Why is that? And I think you alluded to that earlier on, but maybe you can just expound on that a little bit right now.
Sure. So the purpose of focusing on underreported stories is, again, to bring context to the claims that we see in the breaking news every day. So on the front page of a mainstream outlet, for example, you'll see the most recent disturbing ISIS offense that we've been hearing about, or you'll be seeing the most recent update on the Syrian crisis. But at the Pulitzer Center, the aim is to help you understand some context for those issues. So why people choose to join ISIS, for example, is one project. Another is what the Syrian conflict's forgotten refugees are suffering from, health-wise. So all of these questions are so very relevant to the state of global health, regardless of whether they're specifically a global health project or not. And I think the underreported side of these stories is what we try to bring to the forefront, and it takes a more nuanced approach. It takes a longer report, but there's some really strong content there, and it's done by reporters who know their subject area.
I think that's an exceptionally important point to have, because you can read a lot about a given topic and not sort of be engaged in it or even really understand it. I know that there have been stories I've tried to read about like certain aspects of policy, and it's like me and my computer and a dictionary or something, because I don't really understand how it relates back to the issue they're discussing. And so being able to have journalists who can provide really good context to the issue makes everything not just more understandable but relatable. So I'm glad that that's something you mentioned as far as what you try to accomplish and what you're doing with not just the underreported stories, but with all of the stories that the Pulitzer Center features. So thank you.
So
and thank you to you too, Joanne, because you're very good at providing context.
No, talking about stories, Chris, since you mentioned stories right there, I'm curious that what, according to you, Joanne, are the most underreported issues in global health across the world, and also the best reported global health stories that you've ever read?
Oh, the best. That's an interesting question. Well, let's go to what's underreported. Mental illness is underreported when you look at the burden of mental illness in low and middle income countries. I mean, I think people in developed countries tend to think it's almost a luxury to be able to, if you have a mental illness, you can just sort of, get help, but it's a luxury. It's not a luxury. It's really, people get kicked out of their villages. It's a terrible, terrible situation. So I think that's underreported. I think anything besides HIV and Ebola are underreported. There's so many other conditions than neglected tropical diseases are called neglected tropical diseases. I think some of the effects of climate change, people are getting pretty good about reporting that. So things go up and down, they trend. But if I had to pick one underreported issue, it's mental health and mental illness in developing countries. The best global health reporting I've ever seen. Oh, there's a lot of good stuff out there. Boy, I wouldn't even know where to start. The New York Times they did a great story on cancer in developing countries that I really liked. Boy, I think anything that's reported from the ground, from being out there, from real places, has been good. I love Tom Paulson's Humanosphere, his website. He's more into the politics of things and the machinations behind the scenes, but he's just doing a great job. There's a lot of good global health reporting out there. There should be more. There should be more, but I think there's a lot of good stuff out there.
Definitely.
Sorry, jump right in.
Sorry.
Emily, go ahead.
I was just going to mention that in regards to the mental health reporting that Joanne was alluding to, I'm happy to provide some links in the show notes to several of our projects that cover that issue, and they're trying to bring it to the forefront.
Right, and we've talked about mental health on the show before. If you're interested in mental health, go back into our previous episodes. We've got a whole episode on it. And we always talk about the fact that mental health is massively underfunded. It's underreported. People that suffer from mental illness it's got some of the highest contribution to the global burden of disease. So that's my little plug. I used to work in psychiatry, so it's a area that's very close to my heart. We're gonna stop talking about journalism for a second. And we're going to go to Katie's Careers Corner, and she's going to talk a little bit about some job and work opportunities and I think some internships that are available. Then after that, we're going to go back into a discussion section and we'll talk to our guests again. Katie, over to you.
Great, excellent. So on today's Katie's Career Corner. Today's Katie's Career. I'm tongue-tied. We're obviously going to highlight the Pulitzer Center because the Pulitzer Center has internships. There is a stipend included. You do kind of have to be based in Washington, D.C. in their office. And some of their current interns are students working towards a wide variety of degrees. So definitely something to look into. And you can email Emily for more information, and we'll provide that in the show notes. And if you're watching on YouTube, it'll be in the notes below. A second thing I wanted to talk about is actually a mentorship program. So I know we've spoken about other opportunities in mentorship programs. This one is launched just this year, and it's called Global Health Me, or GHME. And it's a new initiative to connect junior and senior global health colleagues across the world. It's a collaborative program launched by the Global Health Next Generation Network and the Swedish Network for International Health. Main goal of it, obviously, along the same lines of mentorship, is to provide a platform to learn new innovative approaches to global health problems and share information in small groups and pairs. And the applications are still open until the end of June, so get your application in. You can go to globalhealthngn.wix.com/mentorship.
Okay, thanks very much, Katie. Now, if you're watching this live, don't go away. We obviously, at the end of the show, we have a discussion time where people can send in questions via Twitter and we respond to them, and the panel will talk to the guests a little bit longer. So if you're watching it live, don't go away. If you're watching this on YouTube or listening to the podcast, I'm sad to say the show is going to come to an end quite soon, but I want you to know you can get in touch with us, you can interact with us. We've got a Facebook page that you can go to. There's also a Facebook page of the Pulitzer Center you can go to. We've got a web page of our own, www.twig.org. You can get us on email at hello@twig.org. You can get us on Twitter at twigteam. At Twig Team. So anyway, you can get hold of us. Please do interact with us. This is the internet. It's supposed to be interactive, so let's interact. If you're watching this on YouTube, come back, same time, same place, next week. Don't ever change. Don't do drugs. Always do your best, and we'll see you then. Goodbye. Okay. Okay, so that is the end of that's the end of the show.
All the struggle.
That's the end of the show on the end of the show that's going to be on YouTube. So from now on, the people that are watching live, there's going to be some back and forth. I've just got a quick question for the guys that are on the panel. We were doing these slideshows for the first time. When I clicked on the slides, did you guys all see the slides, or was it just the people out there? You didn't see
I
the
saw
slides?
them. No, I think you have to click on Katie's window every time she.
I did.
Oh.
I did. So I think the people watching the show out there would have seen the slides, but you wouldn't.
Okay.
I was just curious about that.
Let us
Anyway,
know.
so do we have any questions on the Twitterverse for the panel members?
My computer's a little bit slow right now. I don't have anything yet. But for those of you who are on Twitter or who are going to email us questions, let us know if you were able to see the slides so that we can troubleshoot in the future if need be. And I wanted to make one quick mention because I didn't during the actual show itself. But there is an important project that we've mentioned before on our show about Jordan Jarvis and Tara, one of the other WHO interns that she had a couple of years, or worked with, I'm sorry, they were both interns at the WHO office in Geneva. And they did a project, they're trying to crowdfund more WHO interns from low and middle income countries, and you can find out more. You can go to Twitter, and it's at GH Intern Equity, and that's GHINTERN EQUITY. So be sure to check that out. Check a link to the page, support what they're doing. It's a really fantastic initiative. And then if I can launch right into a question for Joanne, does anybody else have anything that they're dying to ask?
Well, I'm on Twitter. I don't see any questions yet, but I will keep you posted.
Perfect.
Yeah, okay, go ahead.
Then I wanted to ask Joanne about a specific sort of compilation of work that she did for the Pulitzer Center, and it was sort of the Cancer Project, which you won a number of awards for. You did it through a number of different channels, and it received great accolades. But I was listening to some of the audio interviews that you did, and you did some really amazing reporting about the situation of cancer in Uganda. And one of the things that I found sort of riveting was that when you were talking to people and you were telling the story about your translator talking to people with you, that they didn't have a word for cancer. They were just calling it, what was it, like the swelling? Because they didn't realize that all of the things that happen when you have cancer, all of those symptoms and those manifestations, they didn't realize that it was caused by one disease. And I think that's something that really puts into perspective the gravity of the issue. I mean, can you tell us a little bit more about your experiences there and what it was like learning how under acknowledged cancer was in a developing country like that?
Yes, and I'm glad you asked specifically about Uganda, because I also reported from Haiti and India. And what's important about asking about Uganda is they just opened up this big outpatient facility in Kampala that is just incredible. It's a joint operation between Uganda and the U.S., and specifically the Fred Hutchinson Cancer Research Center here in Seattle. They got together and they put up this facility, and what's really important is that it tells people that cancer can be treated, especially a particularly common kind of childhood cancer there called Burkitt's lymphoma. It really does cause these incredible swellings in children in their heads and necks, and people tend to not seek cancer treatment there because they don't think it works, because usually they come, if they do seek treatment, they come in so late that it can't work. And or they can't come back and forth for all the treatments. But this outpatient center is going to be making it easier. But yeah, in a lot of tribal languages, you asked about the swellings. They call it the swellings. So it's a swelling or a lump, and they think, well, I fell down, or somebody wished me ill, or I did something wrong and I'm being punished. They don't think of it. They don't have a concept of cancer. They don't go in for treatment. If they do, it's too late. It's already too late, and it becomes a vicious cycle. But things are looking up in Uganda, at least now, because they've got this facility. It was built where there's a current facility there, and this is an addition to it. But it's so sort of big and bright and shiny and new and it's got trained people, and many more trained people. The old facility had a few people, but just the effort and the idea that cancer can be treated is going to change a lot of people's lives.
That's fantastic improvement. It's great to know that they're putting in the facilities and really working towards advocating and educating people on it and making it not just less stigmatized, but less of something that goes unrecognized. Sultan, I know that you had a question as well.
Yeah, so Joanne, you mentioned you spent time in India, and I wonder if you ever got a chance to kind of also write something about the cancer train. So there's a train in northern part of India which goes from there are villages where you see a lot of cases of cancer because of high pesticide use. If that was an opportunity, you got to actually do some reporting there, because that's something which is quite common, and people still trying to figure out whether it's pesticides or not.
No, I didn't run into that. And Emily, can I have some money?
Sure.
It's a great idea.
Yeah, it is a great idea. Absolutely.
We're just trying to link opportunities with funding here live on today's Twig.
That sounds like a great proposal.
There's a cancer train which goes to take patients from those villages to a cancer hospital in West India, in Bikaner, where people can get treatment, and that train is known as Cancer Train.
Wow. Yeah. Very interesting. Thank you.
Now, I have one quick question for each of you. If you could, I mean, Emily, you've got this interesting perspective of being inside one of these organizations that supports and continues this type of journalism in these projects. And then, Joanne, you have the other perspective of being one of those people who not only collaborates, but gets to do the actual reporting. And could each of you speak to maybe just like a really quick piece of advice that you have for people interested in getting started or early in their career? We often use the term students and young professionals, or SIPs. And so if there's maybe just a bit of wisdom you could impart on people who want to get started.
Sure. I'd say that number one thing to remember is that if you're coming from a field outside of journalism, specifically if you're coming from a global health perspective, your specialization is to your benefit. I think a lot of the time we feel that we're coming up behind because we haven't spent a lot of time in journalism, but having that background expertise is extremely helpful and extremely important. It'll inform your reporting to make it stronger. I'm coming from that angle right now. My entire educational background is in global health, not in journalism, but I've found that as I'm working my way into this field, it's been a huge benefit to me.
Excellent. Good to know that. I think that's an intimidating. Sorry, Joanne, please.
And my answer simply would be get started. You know, if you see somebody who's written something and you want to do that sort of thing, write to that person. Contact that person. Buddy up with somebody. You know, maybe if you can, you know, what Karen Hooster did was, you know, she didn't know much about journalism, but she knew that there was a journalism division here at the University of Washington. She came by my office and said, how do I get started? So she found somebody who had some ideas. So find somebody who has some ideas, buddy up, imitate somebody else, you know, go their path. But just get started, because it's so important that you talk about what you're doing.
Mm-hmm. Mm-hmm. Okay. Well, listen, thanks, everyone. I'm going to have to actually kind of cut it short because I've got a 3-month-old son who needs me at the moment. And unfortunately, if I go, the whole thing closes down. So that's what's going to happen. But thanks everyone to the live audience. Thanks for watching. Come back same time, same place next week.